quite exciting for me to make this video because this is the second to the last lecture in the series of diuretics. Let's talk about carbonic anhydrase inhibitors. What makes this group of medications so much fun is that although carbonic anhydrase inhibitors are categorized as diuretics, they are used for not so much diuretic purposes. I think this unique feature makes it easier for us to memorize this group of medications. Here we have the objectives for this lecture. We have seen this slide in the first lecture of this series. This is the proximal convoluted tubule, where the traffic is quite heavy, with lots of cations and ions, acids and bases, wastes and nutrients, and water traveling in and out of the blood and luminal filtrate. Most diuretics work at the proximal convoluted tubule, and our focus today is carbonic anhydrase inhibitors. As its name suggested, carbonic anhydrase inhibitors block the effect of carbonic anhydrase. Before we understand what carbonic anhydrase inhibitors do, let's figure out what the effects of carbonic anhydrase are. On the epithelial layer of proximal convoluted tubule, the cell faces both the nephron lumen and the blood vessel. Inside this epithelial cell lives the enzyme called carbonic anhydrase, which is in charge of the conversion between carbon dioxide and bicarbonate. The membrane of the epithelial cell next to the blood is called basolateral membrane, while the membrane facing nephron lumen is called apical membrane. Here, let's open up the space between blood vessel and the urinary lumen, and let's also enlarge the epithelial cell. Now let's quickly see how carbon dioxide and bicarbonate convert to each other in the epithelial cell and at the apical membrane. Carbon dioxide enters the cell from the bloodstream, combining with water and converting into carbonic acid. The hydrogen and bicarbonate naturally ionized and released from carbonic acid. At the apical membrane/urinary lumen, hydrogen combines with bicarbonate. Together, they form carbonic acid, which turns into water and carbon dioxide next. At the apical membrane, hydrogen is exchanged with sodium, which enters the cell and eventually being reabsorbed into the blood. Carbonic anhydrase catalyzes the process of conversion between bicarbonate and carbon dioxide. In the cytoplasm of the luminal cell, carbonic anhydrase promotes the converting process of carbon dioxide to bicarbonate. At the apical membrane of the proximal tubular epithelial cell, carbonic anhydrase facilitates conversion of bicarbonate to carbon dioxide. Quite opposite conversion achieved by one enzyme. Imagine what the enzyme inhibitor would do to these two conversions. Carbonic anhydrase inhibitors stop conversion of carbon dioxide into bicarbonate intracellularly. Decreased bicarbonate in the blood leads to hyperchloremic metabolic acidosis. At apical membrane of proximal tubular epithelium, a carbonic anhydrase inhibitor does two things. First of all, it stops the conversion of bicarbonate into carbon dioxide. As bicarbonate stays in the luminal fluid, the urine pH is increased. In addition, it decreases exchange of sodium for hydrogen. Mild diuresis is caused as sodium is increased in the filtrate. Under effect of carbonic anhydrase inhibitors, phosphate is excreted, but the mechanism is unknown. The diuretic effect of carbonic anhydrase inhibitors take effect at the luminal epithelial cell at the proximal convoluted tubule. At the luminal cell's apical membrane, these diuretics stop the conversion of bicarbonate to carbon dioxide, which increases pH level of the urine. They also decrease the exchange of sodium and hydrogen, leading to increased sodium in the urine and mild diuresis. In the cytoplasm of the luminal epithelial cell, carbonic anhydrase inhibitors stop the conversion of carbon dioxide to bicarbonate, affecting the blood. The result, metabolic acidosis, facilitates hyperventilation, which in turn increases oxygenation, helping the body adjusting to high altitude. Another effect of carbonic anhydrase inhibitor is reduction of aqueous humor, decreasing intraocular pressure. It is possible that these medications block carbonic anhydrase in the ciliary body of the eyes. In this group of diuretics, we have 3 medications: acetazolamide, dorzolamide, and brinzolamide. Have you noticed? This group of medications are named zolamide. Common adverse effects are fatigue, abdominal pain, nausea, vomiting, and paresthesia. Acetazolamide has central nervous toxicity, manifested as drowsiness, lethargy, confusion, and fatigue. These symptoms are reversible once the medication is discontinued. Also, during therapy, the patient should be taught to avoid operating machinery or engaging in dangerous activities until the effect of medication is established and learned. Kidney stone can result if patient uses sodium bicarbonate simultaneously. Medical history intake and a list of currently used medication can be helpful to prevent drug-to-drug interactions. While acetazolamide can be taken with or without food, taking with food helped avoiding GI irritation. Carbonic anhydrase inhibitors are indicated for chronic open-angle glaucoma. They reduce production of aqueous humor. Subsequently, intraocular pressure decreases. Dorzolamide and brinzolamide are the choice of medications for glaucoma. Mountain sickness is another indication for carbonic anhydrase inhibitors. Acetazolamide has a prophylactic effect against acute mountain sickness, preventing weakness, breathlessness, dizziness, nausea, and cerebral or pulmonary edema. Ammonia clearance is decreased with usage of carbonic anhydrase inhibitors. Therefore, liver function impairment or liver cirrhosis is contraindicated. Other contraindications include hyponatremia, hypokalemia, hyperchloremic acidosis, and hypersensitivity to these medications or sulfonamides. Carbonic anhydrase inhibitors cause potassium depletion. Therefore, patients with prolonged QT interval should use carbonic anhydrase inhibitors with caution. Medical history intake and physical examinations are essential for preventing undesired effects caused by using medications on patients who have contraindications. Acetazolamide increases urine pH. It can decrease clearance of amphetamine. Effect of lithium is decreased with acetazolamide because the excretion of lithium is increased. Toxicity of phenytoin, primidone, quinine, and salicylates can be increased because acetazolamide decreases the excretion of these medications. Personally, I feel that it is a professional accountability for a registered nurse to help clients making a list of medications she or he takes. The list of medications helps physicians or other healthcare providers to avoid medication interactions. Use with caution and monitor potassium level when using a carbonic anhydrase inhibitor in combination with medications that lead to depletion of potassium. Monitor therapeutic level and effect of lithium when patients use lithium at the same time on acetazolamide therapy. Monitor therapeutic level and effect of lithium when patient uses lithium at the same time on acetazolamide therapy. Monitor therapeutic levels, as well as monitor and report toxicity levels and effects of medications like phenytoin, primidone, quinidine, and salicylates, if the patient is using these medications while on acetazolamide therapy. Acetazolamide can be given via oral or IV route. It is used for glaucoma and mountain sickness. Dorzolamide and brinzolamide are used topically for glaucoma. They do not cause systemic effect. Although carbonic anhydrase inhibitors are not commonly used, it is still very important for us to know this medication well. We need to educate our patients on principles for safe medication administration. There is no antidote for this medication. Let the patient know that they should seek medical attention immediately once overdose is suspected. Thank you for spending time with me. I look forward to having you again in our next lecture.